The Ministry of Health is urging residents to be vigilant as the Caribbean faces its first case of measles in 5 years. Dr. Michelle Fessoir, national epidemiologist with the ministry, explained the importance of vaccination in preventing the spread of the disease.
As the island prepares for the increased visitor arrivals for the men's T20 ICC Cricket World Cup matches and the anticipated carnival celebrations, the Ministry of Health, Wellness and Elderly Affairs remains vigilant of outbreaks in many of the countries globally. Measles is considered one of the most contagious diseases in the world, meaning that it is spread very easily when an infected person talks, coughs, or sneezes. One infected individual can infect almost 90% of their close contacts. Being vaccinated is the best way to prevent getting sick with measles or spreading it to other people. According to the World Health Organization, prior to the introduction of the measles vaccine in 1963, there was an estimated 2.6 million deaths annually. The vaccine is considered a safe and effective method of helping your body fight off the virus.
Dr. Fessoir highlighted the potentially severe complications of measles. Measles cases surged globally during the COVID-19 pandemic due to disruptions in immunization programs.
As a result of this, in 2022, an estimated 136,000 people died from measles, and in 2023, the world recorded a 79% increase in measles cases compared to the previous year. Signs and symptoms of measles usually appear between 10 and 12 days after exposure to an infected individual. But in some individuals, it may take as many as 21 days to develop. Symptoms may be similar to that of the common cold and include fever, cough, runny nose, and conjunctivitis, also known as pink eye. People may also develop whitish spots in their mouths, followed by a rash, which starts on the face and spreads to the entire body. It is very important to note that an individual can spread measles even before the rash appears. In fact, the infection can spread up to 4 days before the rash appears and as many as 4 days after the rash develops. The virus remains active and contagious in the air or on infected surfaces for up to 2 hours. Anyone who is not immune to measles can therefore get infected with the virus.
St. Lucia, which has not recorded a case in over 2 decades, has relatively low vaccination coverage for measles, mumps, rubella. The ministry is taking steps to address this.
The immunization coverage for the 2 doses of mumps, measles, and rubella vaccines, also known as MMR1 and MMR2, for 2023, however, were 85% and 83% respectively. This means that a large enough proportion of the population has not become immune to measles in order to protect the most vulnerable. The highly contagious nature of measles, combined with low vaccine coverage, and the possibility of unvaccinated travelers from areas with higher incidence means that there is a high chance of introduction of measles to our island. The Ministry of Health, Wellness and Elderly Affairs, in preparation for the upcoming mass gatherings, has undertaken a series of activities to improve vaccination coverage and strengthen surveillance and response capacity.
According to Dr. Fessoir, teams from the Ministry of Health are on the ground in areas with low vaccination coverage to encourage and facilitate vaccination to those who have not been vaccinated or have missed doses of any vaccines. Public health officials are urging residents to report any suspected measles cases and to get vaccinated. The MMR vaccine is available for free at all wellness centers on the island. Gino Filippi, HDS News Force.